when you get your master's in clinical psychology, everything that you learn is essentially just the foundation of what you should know throughout your career. And when you're first starting out, it's just a tremendous amount of time just thinking, mapping out information, looking at research, what works, what doesn't work. When we talk about university setting, it's really a wide range. However, I would say the most common cases that I have dealt with is anxiety and depression. To take into consideration that it's not just one thing that causes someone to be depressed or to have anxiety. It could be biological factors, it could be social factors, it could be psychological factors, and most of the time these three factors work together.
Welcome to today's episode of Excel Education Talks. We aspire to inspire you through a series of conversations that we're going to have with people from different industries and educational backgrounds. For those of you who don't know what Excel Education Talks is about, you can watch our introductory video. We'll put the link in the description box below. My name is Iran. I am an educational consultant at Excel Education, which is a university placement agency. For more information about Excel Education, you can visit our website, Facebook, Instagram, LinkedIn or Twitter page, or get in touch with us via email or WhatsApp. Joining Excel Education Talks today, we have Felicia Shamala, who is a clinical psychologist registered with the Malaysia Society of Clinical Psychologists, MSCP. Felicia graduated with a bachelor's degree in psychology from the University of Malaysia, Sabah, and a master's degree in clinical psychology from 𝐼𝐞𝐥𝐢𝐚 University. She has been practicing in the mental health industry since 2017. She's currently working as a clinical psychologist at a local private university and also providing therapy sessions on a freelance basis. Felicia is going to share with us today her journey in becoming a clinical psychologist in Malaysia. So Felicia, thank you so much for being here today.
Thanks for having me.
So we'll dive right in. Why did you want to study psychology?
When I was growing up, I used to be a very sensitive child. My mom would get worried about me because every time I would see something that's sad, for example, we went to Pasar Malam or the night market, I would get very emotional. I would ask questions with my mom as to why poor people exist, why are people in pain. Even if I see a child who's lost, their mother in a mall, be crying, it really affected me a lot. And I think that really concerned my mother as well. I mean, to see a 5 or a 6-year-old asking this kind of question, it was something that was a very unique situation. It got to a point that she stopped taking me to places that would so-called trigger me because she didn't know how to manage this. When I was about 12 years old, one day the same thing happened again, and I got very upset when I went to the Pasar Malam. I went occasionally still, and my mom actually came to my bedroom that night and she spoke to me. She said, you always get upset over things like this, but you getting upset or crying or not being able to go to sleep, none of these things actually help people who are going through a lot. Maybe you should think about what you can do in order to make a difference. So I think that stayed with me. On hindsight, when I think about it, it's being stuck in a situation where you're just stuck in your emotions and you don't know what to do about them. But I think it was a very simple conversation. Interestingly, my mother doesn't remember telling me that. But it's been so many years, but it really stayed within me that I always thought I have to do a job that will make a difference and not just stay in my emotions. So I think from that time on, it was a struggle to figure out what I wanted to do because I knew that I couldn't just take a corporate job. So even up to Form 5, when my friends were all so certain of what they want to do at 17, on hindsight, that also seems unrealistic. I was still stuck, so I decided to do my Form 6 instead. And I felt that was the cheapest option and the safest option as well. So let's say I went and did my Form 6, then I could immediately do my degree. I wouldn't have to do a diploma, etc. So I'm not wasting my time.
And give you an extra year to really think about what you really want to do.
Exactly.
Right? Yeah.
So it seemed like the best option. And when I was doing Form 6, one of my friends actually introduced me to psychology and counseling. Before I had that conversation with her, I actually thought if you wanted to be in the helping field, the only thing you could do was social worker. I guess because also the image in my mind is always the the homeless or the beggars in Pasar Malam. That's all in my mind. So social worker seemed like as a child that immediate thing. But then I think my information related to social work also was very limited, and I couldn't find out any information. I came from a small town. So when my friend introduced me to this seemed like actually something viable, something concrete that I could actually do. So I did my reading on it, and then I compared counseling and clinical psychology during that time, because psychology and then what happens after that. And when I was looking into those two, I eventually decided to do clinical psychology instead. And that's why after I finished my Form 6, I applied to UMS. So UMS, I wanted a course only that had only bachelor's in psychology, but that program had bachelor's of psychology and counseling psychology, so it covered counseling subjects as well. So I thought, yeah, that could be a good exposure, a good start as well before I went into my master's. So that was the plan, to do my bachelor's first and then do my master's. Yeah, so that's essentially very long story. That's essentially how I ended up there.
But you're already very clear that you want to study psychology and then eventually you want to take up a master, right? You say.
Yep.
So to become a clinical psychologist is a pathway that you're already certain that you want to go down to.
Yep.
And you say you were doing reading about counseling and clinical psychology. What's the difference though?
So essentially psychology is the bachelor's that you actually take, and then a specialization so-called would be counseling or clinical psychology. So there will be two different fields out there after you finish your psychology.
Okay. What is the process of requirement in becoming a clinical psychologist in Malaysia then?
So essentially, to become a clinical psychologist, you have to have a master's degree at least in clinical psychology and be registered with MSCP. Right now, that's the ruling. And in order to enter a master's program, you have to go through the universities and see the university's requirement to enter master's in clinical psychology.
What are the requirements?
So for different universities, they're different, but one of the most common prerequisites is that you have to have a bachelor's in psychology.
Okay, so bachelor's of psychology is normally 3 years, right?
Yeah, 3 or 4 years, depending on the university.
Okay, and then you go into a master of clinical psychology, which is normally 2 years, right?
Yes, 2 years full time. Yeah.
Do you have to do practicum before you can actually register with the MSCP?
So MSCP has its requirement of the number of hours that's required in order to be registered. If let's say in that 2 years you're not able to complete the hours that they have set, then you're going to have to graduate, get your certificate, and go and seek additional hours outside under supervision of someone else.
How many hours are we talking about?
1,500.
1,500 of supervised?
That's the current requirement, 1,500.
Oh wow, okay. Yeah. So after you graduated, what did you do? I mean, after you graduated from your Master of Clinical Psych.
So it was December when I was wrapping up all my documentation, and then I started applying and looking out for job opportunities. So I applied in December itself before I completed all my documentation. In January, I went for my job interview, and then I started in February.
So even before your graduation, you already started looking for jobs?
Yeah, I think I'm a very realistic person, and as you can see, when I was doing a lot of planning, even when I was in Form 6, what's going to happen next? So I tend to plan, and I think that financial part, the fact that the field was very new at that point, I knew it was going to take time to get a job, and I had heard a lot of people say that. So I didn't want to wait, and a lot of people were taking breaks for good reason, right? You're very exhausted, but I knew if I took that break, I will delay the amount of time needed to get a job. So I applied while I was still completing my documentation.
But like you mentioned, the field itself at that time was relatively new, considered, right? Was it difficult for you to get a job then?
I honestly think that it's not difficult if you're not picky. Because I remember my lecturer saying during my first semester in clinical psych, and her advice was quite interesting. She said that whenever you go into your first job, you should not be looking at pay. You should be looking at the amount of experience you can get from that job that will actually benefit your career. And I took that advice very seriously, and that's my first semester. And when I finished, I thought about what she said. So I wasn't picky. The first offer that I got, I actually took that.
What was your first offer?
The NGO.
With the NGO. What did you do then with the NGO?
So my title was crisis counselor then.
Sounds intense.
So my job was actually mainly conducting therapy for survivors of domestic violence and sexual assault. At the same time, also managing crisis. So when it's a crisis situation, it could be someone brought to the police station after a very distressing incident, something that happened, and then you can't do therapy during that point of time. So you actually do psychological first aid, which is essentially a crisis intervention. And so after they're calmer and things have stabilized, then if they require therapy or they request for therapy, depending, some people will say they just want to go their own way and move on with their lives. Some people recognize that they need help. Depending on the situation, then you continue therapy with them.
Was it difficult for you having that as your first job?
It was very difficult. It felt like we're thrown into the deep end. I mean, it's a first job, I remember my supervisor saying during my final semester that, when you get your master's in clinical psychology, everything that you learn is essentially just the foundation of what you should know throughout your career. And so if you put that into perspective of what she said, and then you throw it into the deep end, it was a lot. Not just in terms of how much you need to learn, but also emotionally. As I mentioned, like I'm a kind of person, I get moved easily emotionally. So I had to manage that. But I think it was very beneficial for me because it was like a crash course in like how do you manage difficult emotions, how do you attend to difficult cases. So it was very challenging, but I wouldn't change it for anything. I feel in that 1 year I learned to like manage my emotions a lot, my reactions to hearing these very, very difficult stories. At the same time learning, okay, what do you do when you have a case like you really don't know and you don't have enough exposure to deal with it? Like, what do you do with this?
So what do you do? Because like back in uni, before you graduate, you probably have supervisor to supervise you and guide you along the way, right? But when you are at work, like after you graduated, like where do you get your supervision and how do you manage through all this?
So right now I have a supervisor, and I actually reached out to my previous supervisor, the one I mentioned. So she's currently my supervisor, but during that time I didn't have a supervisor. So it was very, very challenging. The main reason I didn't have a supervisor during that time was the financial part of it as well. I just got the job and it's an NGO job, so they wouldn't be paying much. Getting a supervisor would cost a significant amount of money, and which I didn't have. So on hindsight, I would have still paid for it when I look back. But I think because I didn't have that option, I just went all about reading, searching all information I could. I read a lot of books on trauma, on abuse, and what this domestic violence survivors go through. I had to do a lot of reading, a lot of research on my own, a lot of spending time reflecting, conceptualizing. It's not like you don't do that for other cases, you do. But I think when you're first starting out, it's just a tremendous amount of time just thinking, mapping out information, looking at research, what works, what doesn't work. So it's a lot of effort, I would say. Yeah.
Okay, and then so you mentioned that you stayed with this NGO for a year, right?
Yep.
And after that, what did you do?
Yeah, so this project was a funded project, so the funding was stopped, so the project wasn't renewed. So I was informed, they were quite nice about it. They already informed 2-3 months in advance that we didn't get an approval to renew the project. So I had 3 months approximately before my contract actually ended to actually explore options. So it was very beneficial for me because I could start looking already versus waiting last minute and then finding out the contract's not renewed. So from October onwards, I started looking, and I went for a few interviews, and then eventually I settled on a private university that I interviewed for, which I felt would be a good fit. And then I started there.
What do you do as a clinical psychologist in a private university?
So it was a very unique situation, right? I actually had this preconception that, what would it create? Like would it be just dealing with stress management and time management? Because
for students,
yeah, because I worked in an NGO before, which is the total opposite. I guess my own perception that it was going to be, what does it do? But then I think when I got exposed, it was very unique. In university settings, I would say the system is pretty much like anywhere else. You do deal with therapy for clients, you do assessment and diagnosis if necessary, you do every other thing that you would be doing in any other placement. It's just that the system is different. So the registration system, the consent forms, the structures, the guidelines, the SOP of the organization, and all those roles. So it's pretty much therapy, assessment, diagnosis, mental health talks, programs. I think mental health talks and programs would be something unique to the university setting because you actually have to cater to young adults. So let's say you're talking about mental health talks, you're not going to do something that you do in a general public or with women or women's safety awareness or whatever else. You're going to be very related to young adults and what they can actually do about their stress, their anxiety, dealing with conflict, relationship issues, boundaries, all these kind of things. So, and programs, when you talk about programs, you have to look at the organization in general, how all the things keep the dynamics, So if the university is a very high achieving university, the amount of stresses they go through, if the lecturers are very supportive, it's a different dynamic. So to take all that into consideration, create a program that works for awareness, to reach out to them and essentially allow us or the unit to be as accessible as possible to students.
What are the cases that you manage in the private universities then?
So I think that was a bit different. Like we NGO, we talk about women and then generally survivors. And then when we talk about university setting, it's really a wide range. However, I would say the most common cases that I have dealt with is anxiety and depression. But the rest, I think it's quite
among
wide.
The students, like anxiety and depression.
Yeah.
Oh, okay. And why do you think that's like more prevalent among college students?
Interestingly, I don't think it's more prevalent in college students. I think it's prevalent in society itself. But to take into consideration that it's not just one thing that causes someone to be depressed or to have anxiety. It could be biological factors, it could be social factors, it could be psychological factors, and most of the time these three factors actually work together. So let's say your parents already have history of anxiety and depression, then there's the biological factors. And then we talk about social factors. Let's say you come from an environment that's very oppressive. So the social factors will already take into consideration. It will affect your mental health, or risk factor would be higher. And then take into consideration how that social factors will actually affect your psychology. If you're not given a say to do anything, everything is no, everything's being blamed, how that will affect you psychologically. So you look at these three dynamics, they interact and they contribute to anxiety and depression.
Okay.
One thing about the field that I noticed is it brought up a lot of stuff that I was not aware. You're learning all these things about mental health. You learn more and more about yourself. I use cognitive behavior therapy. It addresses a lot of things in the present, but you don't ignore the past. It's not like negating the past or anything, but it's very focused on the present.
What are the challenges that you face so far working in this industry?
You constantly need a reminder that you're not here to create miracles. You're here to actually do your best to your ability and being able to let go after.